Sat Sri Akal. Bright Eyes, Bright Lives. Welcome to the first episode of Bright Eyes, Bright Lives, powered by Garewala Institute. We have Dr. Praveen with us, who's been a surgeon for over 25 years. We welcome her at Garewala Institute, Medicity, New Chandigarh. We would like to hear a little about her from her.
Thank you. It's been a pleasure to join the GAI team, and I joined here as a vitreoretinal specialist, as a senior consultant, and I have been in this field of retinal surgeries for nearly 25 years now, and where I have been performing complicated surgeries like diabetic retinopathy, pediatric retinal surgeries, surgery where eyes are affected by trauma, or retinal detachment and macular hole surgery. And this experience I've had in Shankar Nethralaya, which has been the premium eye institute for specially retina, and it is based in Chennai. As you would know, most of these institutions, we have large number of them in the southern part of the country, and Shankar Nethralaya has been one of the pioneers in the retinal detachment space.
We are honored to have you here with us at Garewala Institute, ma'am. What brings you here back to Chandigarh?
So I am basically from Punjab, born and brought up in this part of the country, and when I had gone to South for my further education and training, and having spent so much of time in an institution with best technology and up-to-date equipments, I always thought that it will be wonderful to have a similar institution back home. And when I did meet Dr. Grewal, and he also shared his vision of having that he must see a center, an institution like this for the people of Punjab, for the people of Himachal, Jammu Kashmir, North, so that they don't have to travel across the country and go south. So I thought somewhere this vision matched, and so we are here together. There's already, we have a team of 5 retina specialists, and I add to that team. And I think with this team, we should be able to deal with even the most common diseases, which are like diabetic retinopathy, which can affect nearly, which affects, in fact, you would be surprised to know that Chandigarh is 5th most prevalent state of where diabetes is seen most commonly, and it can affect 1/4 of the population. So people who have diabetes never get their eyes checked up. So with this, we will be able to prevent blindness due to diabetes together. Then age-related macular degeneration, which is very common in patients above 50 years, will help that. And most importantly, there are some rare conditions where, retinal diseases, where patients don't have anywhere to go in this part of the country, like ocular tumors or genetic diseases of the eye.
Okay.
So this all we are going to bring here, especially the genetics clinic, where diseases like retinitis pigmentosa, Stargardt's disease, these are rare otherwise, but when you put them together, they can be a significant population. And people don't understand that even if you don't see an immediate cure, the future belongs to ocular genetics. Whatever diseases we have, even things like diabetes or age-related degeneration, they still have a genetic basis. So to understand the genetic basis, to prevent these diseases, to prevent these genetic diseases going on to the next generation, it's very important that we start learning in and treating our patients in this line. This is an era of precision medicine. Okay. And by bringing this new technology and new know-how about ocular genetics, we will offer this kind of treatment also now to our patients right here in Garewala Institute.
Looking forward, ma'am. Today I would like to ask you a few questions along with a fun element at the end. Should we start?
Yes, please.
Okay. Can technology, especially AI, replace empathy?
So, first of all, it's a definite no where it can replace empathy. I think I still belong to the old school, where I think patient-doctor relationship is very pious. Mm-hmm. And the way a doctor can, with his or her personal touch, heal a patient and treat a patient, no AI can replace it. But having said that, I think a lot of us have fears about AI replacing our employment, or whether it be the IT
True.
sector or doctors or otherwise. I think we should learn to use it as our best friend and not as an enemy.
Okay. So moving on to the next one. What, according to you, are the real pillars of medicine?
So the two pillars, I would say, the first most important is to have a patient-doctor relationship, and the second is that with such a rapidly evolving technology, the doctors have this responsibility of keeping themselves up to date about the latest technology and the latest medicine and treatments which are available.
How have patient expectations evolved in past 5 to 10 years?
So, especially where eye space is concerned, patients, especially I would say, even something as simple as cataract. At one point of time, you could do cataract surgery, give patient those thick glasses, and they'll be very happy. But now, the patient does not only want clear vision; they want no glasses. They want absolute precision. So, I think that has become very important as patients become increasingly aware of what technology can get, what medicine can get. They demand excellent results. Nobody wants to compromise on not only good vision but with precision, and everybody wants it perfect. So I think the expectations have really skyrocketed.
So how do you deal with patients who are tech savvy and they Google everything before reaching the doctor?
So I just would advise them that please check the authenticity of the material that you are reading, at least, and if going into the future, if as doctors we could provide them with good sites which give them the relevant information, I think that will be working both the ways, because that way we would know what they're accessing, and yet save us the time to in detail tell all the details to our patients about do's and do nots and everything, which they can read on their own. So we can give them links which could give them very good information about their disease. So I think we should again use technology as a friend and help to reach out to more and more patients. Things like telescreening, where patients need not come to the office all the time, and we can do home screening for them, or we can reach far off places. All this is possible thanks to technology. And with the number of population increasing and the number of doctors who are not able to match that population, these things like telescreening and photographs which can be shared, and doctors can online do consults. All this is possible with technology. So let us not forget that. So I think we can use it effectively, and at the same time educate our patients to check the authenticity of the things that they are reading, and trust only good sites which give medical information.
And what is that one thing about internet that annoys you the most?
Yeah, so the results on internet don't come according to the facts. It comes according to the most hits. So if somebody has, so everything is not, you have to know what is correct and then follow it.
Okay.
So that is most important.
So with that, we wrap up interaction session. And let's come up to one rapid fire round, which is going to be quick, crisp, and one word.
Let's hope I can give you one word answers to all your rapid fire.
Early diagnosis or lifestyle change, what matters you the most?
I think both are important. Early diagnosis to pick it up, and the lifestyle modification for long-term efficacy of treatment.
And what is that one thing patients hide from the doctors?
Records of the previous doctors.
I already took medicine before coming here. Is it good or risky?
It is good if it's from an authentic source, but if they have come to me, I think I would expect the patient to have good faith in me and then follow that.
Okay. Google versus doctor, who wins these days?
Hopefully the doctor.
Most dramatic line you've ever heard from a patient?
So when I tell my retinal detachment patients that you will need surgery, but I already had an intraocular lens surgery. So that one putting the lens inside does not solve all problems. So we have to tell them and educate them that retina is different and intraocular lenses serve different purpose.
Okay, that's it. Thank you very much, doctor. Thank you for your time. Thank you for being a part of Grewal Eye Institute. Thank you very much.
It's a pleasure. I'm looking forward to the journey.
Thank you.